I'm Dr. Michael Tlusty. I'm the Director of Research at the New England Aquarium, and as part of my laboratory research I work on growth and physiology of American lobsters, and right now we're actually working on shell disease in American lobsters. And shell disease is it's a bacterial disease, and what happens is the bacteria settle down on this mineral exoskeleton and they start eating away at it. What we have here is, this is an adult lobster. It was about 1 pound old when it molted, and it had shell disease. This is a lobster we grew here at the aquarium, and it was about 2.5 or 3 years old, and it didn't have any shell disease. So you can see how nice and smooth the shell is here, where how gross looking this shell is. See, and so if you look at the shell, this area where the shell disease is right there, you can see how thin that is. And so for a lobster to lose this outer protective covering can be quite bad, because if they get bit by anything, their shell will crumble. Sometimes the bacteria goes in and it can cause a secondary infection. And so we're actually studying why some lobsters are susceptible to shell disease and others can fight it off. And so we look at things such as the temperature they're growing at or the food they eat. And then we also look at how this relates to a molt cycle. Because in an adult lobster, they shed their exoskeleton once a year. So they have to shed it, then grow it, and then this is covering them for a full year. And so we're also looking at factors which can influence, will a bacteria get into that shell within that year time span.